Well, I'm here with Daryl Hart, one of our good patients, and I wanted to take a few minutes to interview him and just ask him a few questions about his care. Daryl's had some pretty amazing results with us, and I think those results are really worth sharing. Daryl, so first off, here's my question. Just for the benefit of the people watching, just describe to me briefly, where were you? What brought you into the office?
I had so much pain in my back and shoulders, and I seen in the newspaper where you were offering a chronic pain clinic. So my wife and I decided to come to you, and that's what brought me in. Just some way of getting ease from the pain that I was having.
So describe that pain. What were you feeling?
Uh, Severe pain up and down my back. I couldn't raise my arms above chest high. I couldn't sleep in a regular bed, and this had went on for about 18 months. I either slept in a recliner or on the floor. It was just every time I got up, I couldn't straighten up, and the pain was just getting to be almost unbearable.
Gotcha. Gotcha.
And I had went to other doctors, and they had given me enough pain pills to supposedly to do the job, but the pills didn't help that much.
Gotcha. So what else, other than, not able to sleep in the bed, and all the pain, what else were you unable to do as a result of the problem?
Well, I'm retired 3 years ago, and my hobby is woodworking, and I wasn't able to work on my house, remodeling houses, or get out in my shop or anything like that for any length of time. Maybe 10, 15 minutes was all I could stand up without having to go sit down.
Right. Wow. Wow. So let's talk about the results you've had, because you've had some pretty amazing results, and I know in the treatment room you've told me you've told me some things that it almost chokes you up, almost brings a tear to your eye, just to see how somebody changes. Tell me, what's life like for you now? What do you feel now?
Life is good. I've finally been able to get back in my own bed.
Awesome.
That's 18 months with a floor and a recliner,
Yeah.
and now I can go down and get in bed like a normal human being and sleep. My back is not as severe as what it was. I can now raise my arms, both of them, up over my head, and that is letting me get back into what I enjoy doing, the woodworking and helping other wife around the house as far as remodeling goes.
Good.
So,
I'm sure the wife's a lot happier about that.
oh yes, oh yes.
Good, good. All right. Well, now just the last thing I wanted to know is share with me when you first came in, your future outlook was really, it was not very stellar. I can imagine that what you thought about your future was not that great, knowing you had to live in chronic pain. Tell me the difference between then and now. What was your outlook then on the future, and what's your outlook now?
Well, I was skeptic. I mean, I had never been to a chiropractor before, but after coming and talking to you and going through this program that you had set me up, my outlook now is 100% brighter.
Awesome.
I tried to keep it bright before, but it just didn't work. I could only hide it for so long as far as not being in pain.
All right.
But as of now, my outlook is good, no pain, and my wife says I'm easier to get along with.
That's always good. Well, Daryl, thank you. I want to thank you just for the privilege of being able to take care of you. It really is an honor that God sends me such wonderful folks to help them change their life, and that is a blessing for me, because like we talked about before, this is really, our steps are ordered, so we are things happen for a reason. So I'm glad you came by. Well, folks, that's the kind of results that Daryl has had. I'm really, truly blessed to be able to take care of people like him. And I know that those results are not uncommon. In fact, those happen a lot around here. So thank you for watching.